Good evening, everyone. My name is Alex Medeiros, and today I'm going to be sharing with you a pressing matter that isn't discussed enough. It often is discreet in plain sight. It exists anywhere and maybe even everywhere, but the only ones who are affected by it are the ones experiencing it. It is called body dysmorphic disorder, or more commonly known as body dysmorphia. Body dysmorphia is a mental health issue which causes people to heavily fixate on flaws they believe associated with their physical appearance. More often than not, these flaws are only small or imaginary to them. People with body dysmorphia often believe they are grotesque, abnormal, or ugly. Most of the time, they will allow these negative aspects to control their lives, causing severe emotional damage and discombobulating the importance of everyday activities. It's more than just your average insecurity. For individuals with body dysmorphia, these feelings are daunting and overwhelming. These thoughts are consistent, intrusive, and cause a lot of emotional duress. Body dysmorphia, BDD, affects approximately 1.7% to 2% of the general population. On the other hand, it may be higher due to biased sources and misinformation. It starts during your childhood, a period when people have become especially conscious of their bodies and how they're perceived socially. Many people struggle with no voice for years on end before officially receiving the help they deserve. Let's discuss the symptoms. Common symptoms of body dysmorphia are spending hours in front of the mirror or avoiding mirrors entirely, constant physical comparison between friends, family, or peers, looking for excessive reassurance about their looks, engaging in repetitive behaviors like skin picking, skin pulling, or spending hours with grooming, avoid social situations or take extreme measures to cover up their perceived flaws, and lastly, they may undergo a plethora of multiple cosmetic procedures, often without satisfaction. The preoccupation can be directed at more than one body part. It can be skin, hair, nose, or body shape in general. This flaw is unobservable and minor to everyone but the individual being affected. Body dysmorphia will take a toll on you not only physically, but mentally as well. Individuals often suffer from anxiety, depression, and low self-esteem. Suicidal thoughts and behaviors are common. The disorder can also have a negative effect towards academic performance, job productivity, and personal relationships. Social isolation is a common theme as well. Many people will isolate themselves from their friends, family, feeling completely ashamed. Sometimes people drop out of school or quit their jobs due to internal detestment to their appearances. Let's talk about the causes, shall we? The leading factors are biological, psychological, cultural, and societal pressures. Biological factors include brain differences or imbalance in neurotransmitters such as serotonin. Psychological factors such as childhood teasing, trauma, or abuse can trigger distorted self-image. There's also cultural and societal norms that come with it, especially with the media setting unrealistic beauty standards. We live in a world that has a dangerous obsession with perfection, filtered photos, and overly photoshopped bodies, which can make individuals feel as though they will never be physically enough. Now, body dysmorphia is treatable. There is a cognitive behavioral therapy, which is the most effective form of treatment. It allows individuals to challenge themselves about their appearances and develop healthier habits. There is medication for this as well, particularly serotonin reuptake inhibitors, SSRIs, can help tame the symptoms, especially in moderate to severe cases. And lastly, there are support groups as well who perform mindfulness practices and self-compassion strategies which can assist the recovery process. Here's how you can help. Educating yourself and others about the disorder, being mindful of your language, meaning steer away from body shaming and appearance-related compliments, supporting friends and loved ones who may be struggling, and speaking out for mental health resources in schools, workplaces, and communities. To conclude, body dysmorphia is a serious yet often overlooked mental health condition that affects people across all ages, genders, and backgrounds. It robs individuals of their confidence, their social lives, and in some tragic cases, even their will to live. But with awareness, compassion, and access to appropriate care, recovery is possible. We must create a culture that prioritizes mental health over appearance and self-worth over perfection. Thank you for listening, and remember, real beauty is not in the reflection. It's how we treat ourselves and others. Thank you.